and sexuality. So sleep and sexuality go together so well because if you don't have good sleeping, you don't have good sex.
That's right. All right. Well, you can share your screen now if you want.
I'm Dr. Duffy McMahon, and I am a behavioral sleep specialist, but I also have my degree in human sexuality for my Ph.D. We're going to spice up your sleep life with sex because we want to know about the relationship between sex and better sleep. How does it change when you have children, bringing home baby? What if you don't have a partner? What if you're single and you want to be single and you don't want to have somebody around and you don't care if you have a significant other? And then my favorite is sex and seniors. And as we do that, we talk about how this affects all of us. So, what is the relationship between sex and better sleep? Well, there is a correlation because whenever you have sex, it releases your wonderful hormones, such as your estrogen and your progesterone, which makes you feel better and helps release stress. And whenever you don't sleep well, one of the things that happens is it releases the hormone cortisol. And cortisol is what causes you to feel bad, to get depressed, and to have anxiety and to have stress. And so you really don't want that. So you think about, okay, fine, I'm going to be able to sleep good, be with my partner, have a good time. And if you have a good night's sleep, you'll have better sex. And if you have better sex, believe it or not, you actually do have better sleep. And one of the questions I'm asked a lot, well, what if I'm a night owl and my spouse is an early bird? Well, that happens a lot. So what you do is you figure out, okay, how do you get together? You both need your own sleep time. If you're a night owl, you might go to bed at midnight and get up at 7 or 8, depending on how much sleep that you need. If you're an early bird, you might go to bed at 9 and get up at 6 or 5 or 4, depending on how much you like to get up. So you have to be able to come together and figure out what that you can do. So if you've got an early bird that is your spouse, when they go to bed, you might come in and cuddle and have sex before they go to bed. It will still make you feel good whenever you go back to bed. The other thing is that you try it the other way around. You have sex in the morning. Nothing wrong with that because it'll actually make your day a lot better. And what you're doing with both sex and sleep is you are boosting your hormones. You are getting better hormone release with estrogen and progesterone, and you just literally feel relaxed and you feel happy, and it increases your day's production time. You just do everything better. So there is a huge relationship between sex and sleep, and we need both of them, both sex and sleep, to have a really good life, especially as you get older. And so we look at, okay, well, I just got married and we're bringing home baby. Here is a living $80 out of you. Two things happen. When you bring home a baby, your wife, the mother, is going to be having some problems for a while after the birth of the baby because one, she's going to be tired, and two, she has released all these hormones from having a baby, and it takes a while for them to replace themselves. But doesn't mean that you can't have sex after baby. And you can have sex with the baby in your room. If it's in the crib and not sleeping with you, that's fine. Many experts say, okay, you shouldn't have sex around your children. Well, that depends on age. So we look at bringing home baby. It's fine. The baby's going to be in the crib or the playpen next to you sleeping. It's not going to get up and point and laugh. It's going to basically sleep. Okay. Well, when it becomes a toddler, it's just a little bit different when it gets to be about 13 months old and just walking around. And even at that point, they may still be in your room. You still may have that bed in your room. But here's what, you guys might have a different room that you can go to and not have sex in front of the baby because a lot of things can go on. And you want to have that privacy. You don't feel comfortable having sex around the baby when it's older. So that's that comfort level. The most important thing is that whenever you bring home baby, you have to remember the relationship between mom and dad is as important as the relationship between mom, dad, and baby. You need to be able to keep that communication, that intimacy, and that ability to sleep, because when you first bring home that baby, sleep is going to be tough. You're going to have the baby up at different hours of night. It's going to play havoc on your sleep schedule. And what you want to do is work together as parents. When people have a baby, one of the first things I say is, okay, Dad, either in the hospital room or as soon as baby is born, you go ahead, sit in the room with your wife, take your shirt off and put that baby skin to skin against you, because it's what helps you bond. And that way dad bonds with baby as much as baby bonds with dad. And it's very important. You need to realize that baby is important, but it's not as important as your relationship. You want to keep your relationship going. You want to keep that intimacy going. And mom, you're going to be tired. And actually, dad, so are you. You're going to be, and you're going to feel left out, dad. Don't. You keep together by working together with the baby, and you keep together by spending time yourself. One of the rules I always told parents is that after the baby's born, have 1 day a week that is yours. Have a babysitter, have your mom, your dad, or your grandparents, or whoever take care of that baby, and then go out, because you and mom have to be able to stay together and be able to talk about what's going on. And dad, you need to help mom with the baby so she can get sleep, and dad needs his sleep too. And we say, oh my God, I've got a 4-year-old, my toddler just walked in on us having sex. And you go, oh my, it's every parent's nightmare. And the reason being, and most experts say, try to make sure you have a closed door or a locked door so that doesn't happen. But if it does happen, it's not the end of the world. The biggest thing that happens is that mom and dad overreact. And all you need to do is make sure that toddler knows that daddy is not hurting mom, and teach him early on to understand that mommy and daddy have their private time just like they have their sleep time. We talk in sleep that the bedroom and the bed is for sleeping and for sex, and maybe if you're sick. But sleeping and sex are what it's for. And really, you see all these commercials with having mom and dad and kids in bed. No, the bedroom and the bed are strictly for sleep, and you need to teach your children to sleep in their own bed. And so when they get older, when they get to be teens, they don't care if you're having sex, but they just don't want to know about it. So we keep on going, and that's the whole thing. But the biggest problem is that you need to figure out what your sleep time is, what your intimacy time is, and what your sex time is, and take care of it that way. What if you don't have a partner? Hey, thank goodness for toys. I'm a firm believer in vibrators. I think they're great for everybody. And something, they have toys for men and women. So don't think it's just a vibrator. Men have apparatuses too to help them with being able to have their own ejaculation and be able to have their own sense of an orgasm and make them feel better. And I tell a lot of women that are single, regardless of age, and men, it's really good for you to have a orgasm on a daily basis. And I say that because it's a release of tension. We have tension that builds up on a daily basis, and it's okay. It's part of who we are. It's part of us as humans. The problem is we worry way too much about what does society think. Who cares? Okay, first of all, it's none of their business. Second of all, we are raised to think that sex is bad, dirty, evil, sinful, and shameful. No, it isn't. If it wasn't for sex, we wouldn't be here. So think about it that way. What we learned growing up, uh, some of the aspects of the myths that we've had growing up, are things that we got to get rid of and realize that sex is a normal part of our life. Sex and sleep are what keep us healthy and happy. And we have to just go along with what we think is best for us. Don't worry about having uh, sex alone, mono sex, just by myself. And even if you're married and your husband is having illness, still be able to have an orgasm. the biggest thing is that it's getting rid of stress in the body. If you want to think of the aspect of um, Asian medicine, we have the seven chakras. Well, your root chakra is your second chakra is your sex chakra and it's your spiritual chakra. And that sounds like it's kind of a dichotomy, but it isn't because it's a spiritual experiences having an orgasm. You feel it, the release is amazing, and it should be able to release that and make you feel good enough and tired and relaxed enough so that you get a good night's sleep, whether you have a partner there or not. So you can think about that. It helps you with your stress, it helps you with your sleep, even if you're single. So never, ever, ever, ever worry about it. But the biggest thing is with toys, go someplace where you can find out what will be the best one. And be careful because with toys, you have to worry about it being too um, dramatic so that the vibration is too strong. That's the only thing you have to worry about. So talk to them at most of the toy places or like Fascinations or what is it, Castle Boutique. Have people that will be able to show you what toys are good, what will help you. They're very, very helpful. So don't be embarrassed to go in to find out. They'll be glad to help. Now here's my favorite. Sex and seniors. Dirty old men, horny old broads, right? That's what they say. No, it isn't. Ironically, sex after menopause is great because most women, if they're not having problems after menopause, actually feel more at ease having sex. The only problem that they have is that they might have some problems with lubrication or tightness, whatever. So don't worry about it. This is where you get your hormones looked at. You have to sit there and think about what do you need to do. My dad, at the age of 80, was absolutely amazing. He comes home one day, and I went over to visit my parents. A lovely little story. My dad said, "Oh, the doctor had given him this little blue pill." This was a long time ago. He was 81 years old. Viagra had just come out. My parents have been very open about their sexuality all of my life, so it wasn't anything new. And so he said, "Well, I took it and I almost passed out." I'm going, "Dad," I said, "what did the doctor tell you?" I said, "Did he tell you anything about Viagra?" And he says, "No, just that it might help me, even though I don't, quote, I don't have a problem at 81." And I said, "Okay." I said, "So he didn't tell you that your blood was going to rush down to your testicles and you could pass out?" And he said, "No." That was a big part of it. So, but it is. My parents were in their 80s. They were still having a very intimate sex life, and that was great for them. And were very intimate up until they passed away in their 90s. So we have senior living areas all over the place. We think about older people not having sex. Wrong. They're having lots of it, which is the villages in Florida, for example, is one of the largest senior living areas in the United States. And tragically, it's also one of the highest STD and STI areas in the United States, too. So they're having sex. And it doesn't matter how society views senior sexuality because there is no age limit on sex. If you're feeling good, if you're able to, whether you can have an erection for the men or not, or use a ED pill is up to you. But having the intimacy, having other ways to be able to be intimate and to have sex and to have an orgasm and stay together is wonderful. One of the problems when it comes to sleep with sex and seniors is that your levels change dramatically. So I always say, please, whenever you go through puberty, men, when you get past 50 or 55, please get your hormone levels checked. Men's testosterone drops, women's estrogen drops. And because of that, you will have problems sleeping, You will have problems with tiredness. You will have just a lot of problems. You will have problems with erections. So again, these are things that you need to do. And when they drop, it also is a problem with your sleep. One of the ongoing things that I see at the sleep center when I'm doing working with insomnia is people that are older that are having insomnia and they have gone through a menopause, whether it be male or female, and they're just not sleeping right. And part of it is the fact that they may need to look at and get a sleep apnea test, or they need to go have their hormones checked and see what they can do to feel better. A lot of people talk about, well, I don't want hormone replacements. Well, you don't have to. There's things that you can do to make you feel better, to give you that sense of youth and have you have a wonderful sex life. So regardless of what that you do when it comes to sex and sleep, the most important thing is having a good night's sleep, however many hours that you need, and having a good sex life, because that's what makes you happy. Okay, thank you.
All right. We can open it up to questions. I want to ask you a question, Duffy. Did you know that people with men, I should say, men with untreated obstructive sleep apnea will also experience erectile dysfunction?
Oh, definitely,
Okay.
definitely.
So
Yeah.
I wanted to just point out, if you have untreated sleep apnea, and they have really great treatments now, you know, it's not
Oh,
only CPAP. CPAP is the primary choice of treatment, but there's oral appliances, there's Inspire. So if you're struggling with this and you're a man, make sure you get your sleep apnea treated.
it is one of the things they really need to know about, because a lot of men are not, a lot of men think sleep apnea comes only with older age. And it doesn't. It can come at any age. There are children that have sleep apnea. So you need to really look into it. If you're starting to have any type of sexual dysfunction for a man, don't just rely on getting Viagra or getting a pill. Get yourself checked in a number of ways. I agree with that wholeheartedly.
All right. So if you want to stop sharing your screen, we'll open it up to questions, and I'll draw the winner. I have my all the names in a hat here. Can you see how to do that? Maybe I can do it. There you go.
There
Great.
you go.
Then we're side by side so everyone can see it. Hi, everybody. All right. I got a little red hat.
Do we have any questions out there that they want to know?
Yeah, let's see. Go ahead and chat them if you want. Let's see
Hi.
what the winner is.
Again, I talk about sex a lot and it embarrasses a lot of people, ironically, especially men. And they don't feel as comfortable with it. I mean, it's fine if they're in a gym setting and talking to the other guys, but when it comes to talking about sex and sexuality uh, in a co co-educational setting, they're very uncomfortable. And I want men to learn to be comfortable with their own sexuality as well as women. Women seem to be okay with it. Men don't.
Um, if you, I see someone's raising their hand. If you guys want to just chat your question in the Q&A, or I could allow you to talk if you want, but I'm trying to keep privacy, right? Because we are a medical team here. Judy, you're the winner of 101 Nights of Great Sex, the book. And so I will email you to get your address and get that out to you. Congratulations. All right. Any questions?
I think one of the things I've always wanted to get across to people is that your sexual life is very important to you, regardless, and not to buy into society's aspect of our Puritan views. Um, it is a part of who we are, and it's a part of our way of bonding with our significant other.
Very important. All right, I'm going to take this person off. I'm going to allow him to talk because he wants to ask a question, and I feel bad when people don't know how to type in the chat or the question. Hi there. Did you have a question?
Yes. Are you talking to me?
Yes.
Right?
Hi there.
Hi. Yes, I have a question. Do you do the hormone testing at Valley Sleep?
We don't.
No.
We don't. What part of the valley do you live in?
Well, I've been through this several times.
Okay.
Yeah, we live in Gold Canyon, but
Okay.
I've been through this several times with 2 or 3 different opportunities, and it really has not been a very effective.
I would highly recommend Dr. Melody Rodarte at Activated Health. So it's activated.health is her website, and she's in Gilbert, so that's not too far from you.
Oh well, it doesn't matter that anywhere is
She's
activated.
internal medicine.
Call it again. Activated what?
Activated.health.
Health. Okay.
She's my personal physician. She's board certified internal medicine. Very, very smart. I mean, I survived 2 cancers. She's the reason I'm still on the planet. She's very, very good. And I can also reach out to you and send you that. But that's a great question.
That'd be great.
Yeah, one of the other people is that there are a number of doctors that specialize strictly only in hormones, and so I have one that I work with too. That's very good, and she's in the East Valley, and I'll give her name to Lori if you reach out.
Okay.
So here's another great question. I'm going to put you back on mute if you're done. Is that okay?
Sure.
Thanks for the question. Great one. Here's a really good question. We have someone here who is a breast cancer survivor. I am as well. And we have to take hormone blockers due to breast cancer. Will this affect your libido or sex? I mean, I can speak for this on my own. I don't feel that it affects libido. Maybe in the beginning. And Dr. Duffy, if you want to elaborate, but I will tell you that there's a lot of things that go along with women in breast cancer and having to have their hormones blocked. Sex is very painful. And then that causes a problem for the man when they think they're hurting their wife. If it's a husband and wife relationship or a girlfriend and boyfriend relationship, but it's a lot. It's kind of like you use it or you lose it. And there's just a lot of things that go into this. There's, believe it or not, like lidocaine numbing creams that can help. There's procedures out there called like Mona Lisa Touch that are very expensive. For me, it didn't work. But it works for lots and lots of people. But again, having breast cancer, having to take hormone blockers is a whole nother subject in itself. Go ahead. You want to talk about that?
Well, the one thing, there's 2 things that go on, not just the medication that you've had to take and not only the blockers, but there's a psychological aspect that goes on. If you've had a mastectomy and so forth, a lot of women feel very uncertain of their own bodies anymore. And in doing so, they pull back. They think that their husband do not find them attractive anymore. They put a lot of pressure on themselves. They feel like they've lost their femininity, if that's the best way. The drugs that you take after chemotherapy and going through chemotherapy is going to be very, very difficult on having any type of sex because of the chemotherapy and being sick and all the things that you go through with it. But any type of blockers like that for your hormones is going to cause you some problems. And that's why it's really necessary to talk to a doctor, like Lori says, about what that you can do. If there's a problem with hurting, vaginal dryness, any of those things, your doctor should be able to tell you what you can use. There are different lubricants, there are different situations that you can do to take care of yourself. But the biggest one is that just because you had breast cancer does not mean that you're not a female, that you're not beautiful, or that there's anything that you're less than a wonderful woman that you are. Okay?
I will tell you, CBD lubricants are really
okay. Yeah, I was going to bring up the cannabis, but I decided not to.
Yeah, well, I just did it, so there you go. You're off the hook.
That's one of the things I tell people is CBD.
Coming soon, we're going to learn more about CBD and cannabis and all that stuff, and we're going to have some future webinars.
Yes.
Thank you, everyone, so much. Is there any other questions out there? Anybody on Facebook have a question? it does drive me crazy that medical doctors don't talk to you about this stuff. So if you have insomnia, any type of thing, if you think you have a sleep disorder, go to valleysleepcenter.com, book an appointment. If you, once we rule out a sleep disorder, you can see Dr. Duffy. If you're struggling with insomnia, you can't go straight to her. We need to make sure she's your treatment with Dr. Duffy. It has to be ordered by one of our board certified sleep doctors or nurse practitioners. So she does do CBTI, which is cognitive behavioral for therapy for insomnia. And she has a huge, a lot of years, a huge history.
A lot of years.
With anxiety, depression, having a degree in human sexuality. How cool is that?
Well, one of the things I want everybody to think about when it comes to insomnia, and one of the things that is very important to you, when you go to your regular doctor and you're saying you can't sleep, don't just go by getting a pill. I'm sorry. That may help you, but the problem is you need to find out what is causing the insomnia. It might be just stress and anxiety. But the problem is the pill is going to bypass your sleep system and you're not going to get a good night's sleep. And what we're finding out now, they're doing so many studies at Mayo Clinic, at Cleveland Clinic on not just apnea and sleep, but on insomnia and sleep and what it does, one, to your heart, but two, to your brain. They're now finding ways that it has an impact on dementia. So please don't take it lightly. Don't just say, oh, I couldn't sleep, that was fine, and I'll be able to, because it ends up adding up. You can't sleep last night, well, then you can't sleep tonight, and then you tell yourself you can't sleep the next night, and it becomes a very vicious cycle. So there's all kinds of things you can do. One is doing the sleep apnea, because that's a big part of what causes you not to sleep. Your hormones are another thing that can cause you not to be able to sleep well. And these are all things that you can take care of.
Yeah. And I just want all of you to know out there, like, you can sleep without any hormones, because I do sleep and I don't have hormones. And I, had to take a hormone blocker for 5 years, and I am sleeping, and I'm, every day that goes by, I get better and better. Any other questions? This is so great. We could go on and on. Maybe we'll have more. Also, the doctors' names. Yeah, I can chat those in the chat. So Melody Rodarte, activated .health. GALT. She's my favorite. And her mother had breast cancer, so she's really familiar with them.
And then I send people to Ilona Bleeman. She is she's a nurse practitioner who has studied hormones for the last 30 years.
And how do I spell her name?
Ilona Bleeman, Bleeman. And I don't have my phone in here. So if you you can look up Ilona Bleeman. She is located at let's see, Greenfield and the 60s. She's over by the Mesa office.
Okay, I'm trying to type. I typed it to you and not everybody else. Activated.health, Dr. Melody. And you guys can email me. You're all going to have my email after this. And then ILONABLEEMAN. Okay. So,
yeah, gotcha.
Ilona is in Mesa, Greenfield in the 60. Melody Rodarte is at Higley in the 202. Out in Gilbert. So
yeah, and just give them a call. Find out what's going to be best for you, because not everybody can take hormones whenever they're older.
Yeah,
but there are lots of different ways to feel good.
Yeah, isn't that great? All right. Thank you again, everybody. Congratulations to Judy. I'll email you probably tomorrow. And thank you so much, Dr. Duffy. We look forward to seeing you soon.
Thank you. I enjoy being here with you and loved having the little chance to talk about sex and sleep.
All right. Have a great night, everybody.
Bye-bye.